You know, one of the best things about the 208 is when we do a story on something one day, and then a day later, or even that same day, we get a message from one of you, which opens up the opportunity for other perspectives on that topic. And one of those is what we talked about last week: mental health resources for Idaho students. House Bill 684 would increase access to behavioral health services in schools, give students a chance for maybe a telehealth session in private on school grounds. A big deal considering 44% of Idaho high school students have struggled with moderate to severe depression. That's according to a survey done by the Boise School District a couple years ago. And 33% have actually thought about suicide. Well, after we talked about it passing the House last Tuesday, we got a message from a therapist who worries about students having to wait to get a traditional session with a counselor. Sometimes it's too late. And while that text told us a lot, Rebecca Rand, well, she had a lot more to say in person. Perhaps the most important, she says taking your kids to get the help they need doesn't make you a bad parent.
When the legislature debates major topics like mental health, it opens the door for the whole community to learn more. House Bill 684 looks to establish optional behavioral health in the form of telehealth for Idaho public schools. Legislation essentially allows public schools to provide access to therapy and counseling services via telehealth on school grounds during a school day.
Do you get a lot of calls from families that say, I have a kid that needs to talk?
Every week,
Really?
every week.
Rebecca Rand is a licensed clinical social worker that owns her own practice in Eagle. Rand has worked as a licensed therapist since 1996.
It's not that we have more mental illness. Everybody's so afraid there's more. We have more awareness.
Awareness is good, Rand says, and House Bill 684 caught her attention. From her experience and conversations with other providers, she believes the proposed law would be a fantastic tool.
One counselor has to cover like multiple schools because that's what's happened. And they get overworked, it's difficult, and some of the school counselors, you know, because of some of the things that are going on, they're overwhelmed, okay? So they need the support so they can do their job better.
Rand is one of many providers that use telehealth to connect with clients here in Idaho and other areas too. She believes getting that as an on-campus option for students will be impactful.
I agree with everybody that said reading, writing, and arithmetic is what the focus is, but you can't focus on that if a child is having an issue where they're depressed, they're anxious, they're not focused, you know, and so having them be able to step outside, maybe cope with it, not have to take off school, not have to miss a test, not have the parents have to explain, I got to take my kid out of school, which then creates some, you know, anxiety with the parents sometimes. It's huge.
A hurdle Rand has seen to the conversation or seeking care for a child, parents worried about what that decision says about them.
It really has to do with your having the courage to not see it as, you know, it's a flaw that you have or something's wrong with your child, but more like, I'm going to get a resource that's available right here. Let me just read and see which one fits for me and my family.
House Bill 684 aligns with the family-centered value of parents and children talking together about finding a solution.
It's mental health. It's not because your kids are crazy. It's because they need to talk just like any other human being, and they're trying to figure it out. And all we do is try to normalize it and make it such that it's not the stigma. Parents can keep from having stigma when they start addressing it as this is a normal thing to do, to just want to talk about feelings, because that's the truth. It is normal.
While increased access is great, it is only as great as people allow it to be. Rand says getting resources before a possible crisis is key. Access to more resources through telehealth, it allows social workers to connect and build meaningful relationships with families and children in need.
And when there's a crisis, then we're talking hospitalization or juvenile detention or truancy or whatever. No, when your child starts looking like something's not quite right, that's the time to start looking, because there can be like a 3-month waiting list because of the volume of people that want help. We have an impact on the future, and our children have an impact. So empowering your community and your kids is all about us being stronger people and mentally well.
And you heard Rand allude to it. She's very honest. The experts, the licensed clinical therapists, the counselors, they're really booked up right now. So if you think this is a direction that your family could go, reach out now. Don't wait before it's a real big problem. But she tells us that she can't take on every single client, but she picks up the phone, she answers everyone, and she helps the best she can to push people in the right direction. But Brian, sometimes, you know, needing that push, that's really all you need. I think there's a lot of families that they don't know what they're doing. So it's a very scary way to kind of go into this conversation. Also, by the way, that legislation that we talked about, waiting for a hearing over in the Senate. Representative Dory Healy actually just emailed me a few minutes ago. She says tomorrow at 3 o'clock it will be in the Senate Education, so we'll keep an eye on that.
All right, it kind of encapsulates the entire health industry in Idaho. Shortage everywhere across the board, so making it more accessible. All right, could be a good answer for that. Thanks, Joe.
Yeah.